Did you know that some common medications can seriously damage your kidney health without you even realizing it? This statement may sound alarming, but it is a reality that affects more people than we imagine. In fact, it is estimated that 1 in 10 people will experience some form of kidney damage in their lifetime, and in many cases, the culprit may be in your home medicine cabinet. Have you ever wondered if that medication you take every day could be silently damaging your kidneys? Stay with us, because this video could be the wake-up call you and your family need to avoid serious complications in the future. Welcome to Health Now. I'm Dr. Garcia, a cardiologist and passionate about sharing information that can transform lives. On this channel, our goal is to help you take better care of your health with practical and accessible advice. Today, we're going to talk about 7 common medications that, while helpful in many cases, can harm your kidneys if not used properly. In addition, we'll teach you how to identify them, what steps to take to protect yourself, and how to adopt healthy habits to prevent kidney problems in the future. Before we begin, I invite you to subscribe to our channel and activate the bell so you don't miss any of our content. And make sure you stay until the end, because the last recommendations are the most important for the health of your kidneys. Let's get started. When it comes to common medications that can affect the kidneys, nonsteroidal anti-inflammatory drugs, NSAIDs, rank high. Drugs like ibuprofen, naproxen, and others in this class are widely used to relieve headaches, inflammation, and everyday discomforts. However, excessive or prolonged use of these drugs can cause serious problems with kidney function. NSAIDs work by blocking certain enzymes that cause inflammation and pain, but they also reduce blood flow to the kidneys. This effect may seem harmless in young, healthy people, but in patients with pre-existing conditions such as diabetes, hypertension, or kidney failure, the impact can be devastating. In extreme cases, continued use of these drugs can lead to acute kidney failure. It is important to remember that these drugs are not harmless, especially if taken without medical advice. People often underestimate their potential harm because they are available over the counter, but this does not mean that they are safe in all circumstances. What can you do to protect yourself? First, avoid taking NSAIDs for long periods of time and never exceed the recommended doses. Second, always consult a doctor before using these medications if you have a history of kidney or cardiovascular problems. Finally, stay hydrated, as good hydration helps minimize the impact on the kidneys. Small actions like these can make a big difference in protecting your kidneys. Now that we understand the risk associated with NSAIDs, let's move on to the next group of medications that could be harming your kidney health. Antibiotics are essential for fighting serious infections, but some of them can be toxic to the kidneys, especially if used inappropriately or in patients with pre-existing conditions. Among the most dangerous are aminoglycosides, such as gentamicin, and others such as vancomycin, which are often used in severe infections. These drugs can damage the microscopic structures in the kidneys responsible for filtering toxins and maintaining fluid and electrolyte balance in the body. The risk increases in older people, those who already suffer from kidney failure, or in cases of prolonged treatment. In addition, dehydration during use can aggravate the negative effects. What can you do to protect yourself? The first thing you should do is discuss with your doctor whether there is a less aggressive alternative to treat the infection. Many times, safer options can be chosen depending on the condition of your kidneys. Second, stay well hydrated while using antibiotics, unless your doctor tells you otherwise. This helps reduce the concentration of the medication in your kidneys, decreasing the risk of damage. Finally, follow your doctor's instructions exactly. Do not prolong the treatment or adjust the dosage yourself. Self-medication with antibiotics can not only damage your kidneys, but also contribute to bacterial resistance, a global health problem. In the next section, we will explore another group of commonly used medications that can affect kidney function. Stay tuned. Medications to treat high blood pressure are essential for millions of people, but some of them can have an impact on kidney health if not used properly. Common ones include ACE inhibitors, such as captopril and enalapril, and angiotensin receptor blockers, such as losartan. Although these medications are very effective in controlling blood pressure and protecting the heart, their use can increase potassium levels in the body. This excess potassium, known as hyperkalemia, can overload the kidneys and, in severe cases, lead to complications such as kidney failure. Additionally, in people with already compromised kidney function, these medications can reduce blood flow within the kidneys, which worsens their ability to filter toxins. That's why it's crucial to use them under strict medical supervision, especially if you have diabetes, kidney failure, or a history of cardiovascular disease. To minimize risks, be sure to have regular blood tests to monitor your potassium levels and kidney function. If your doctor has prescribed one of these medications, never adjust the dosage on your own. Also, avoid combining them with other drugs or supplements that may raise potassium, such as some diuretics or salt substitutes. Blood pressure control is key to protecting kidney health, but it should always be done responsibly and with the support of a health professional. In the next chapter, we will discuss a group of medications that many use for heartburn, and that can also be problematic for the kidneys. Antacids are a quick and affordable solution to relieve heartburn, but those containing aluminum and magnesium can have negative effects on kidney health, especially in people with pre-existing kidney failure. These compounds, when they accumulate in the body, can overload the kidneys and cause them to deteriorate. Aluminum, in particular, can cause problems such as bone weakness and neurological disorders if not properly removed from the body. On the other hand, excessive magnesium can lead to electrolyte imbalance, especially in patients with compromised kidney function. What can you do to protect yourself? If you frequently need antacids, consult your doctor to identify the underlying cause of your heartburn. There may be a milder alternative, such as acid-blocking medications or even natural remedies. Another option is to opt for antacids that do not contain aluminum or magnesium, always checking the composition on the labels. Also, avoid self-medicating and consult a health professional if you have a history of kidney problems or are taking other medications that may interact with antacids. Taking care of your kidneys depends not only on avoiding harmful substances, but also on paying attention to your body's signals and seeking appropriate medical advice. In the next chapter, we'll explore a medication widely used by people with diabetes and its potential risks to kidney health. Diabetes is one of the leading causes of kidney damage worldwide, and medications to control it, while essential, can also have side effects on the kidneys if not used properly. A prominent example is metformin, a commonly used drug to control blood glucose levels. Metformin is generally safe, but in people with moderate or severe kidney impairment, it may increase the risk of a condition called lactic acidosis. This rare but serious complication occurs when lactic acid builds up in the body due to the kidney's inability to remove it efficiently. To minimize risks, it is crucial for people with diabetes to have regular checks of their kidney function through blood and urine tests. These tests help determine whether the kidneys are working properly and whether it is safe to continue treatment with metformin or other medications. If you have diabetes and compromised kidney function, your doctor may adjust your dosage or recommend alternatives to control your blood sugar without compromising your kidney health. Additionally, maintaining good glucose control and eating a balanced diet are key steps to protecting your kidneys in the long term. Remember that diabetes not only affects the kidneys, but can also aggravate other health conditions. In the next chapter, we will discuss a group of medications used for pain management that, if not managed carefully, can also overwork the kidneys. Opioid painkillers, such as tramadol and codeine, are frequently prescribed to treat moderate to severe pain. Although effective in controlling pain, prolonged use or use in high doses can have negative consequences for the kidneys. One of the main risks associated with opioids is urinary retention, a condition that occurs when the bladder is not emptied completely. This can lead to a buildup of pressure on the kidneys, affecting their ability to filter waste and toxins from the body. Additionally, in people with pre-existing kidney failure, opioids can worsen kidney function by disrupting fluid and electrolyte balance. To protect yourself, it is essential that opioid use is always supervised by a doctor. These medications should not be used for long periods of time or to treat mild or temporary pain. If you are taking opioids, pay attention to possible symptoms such as difficulty urinating, swelling, or fatigue, and report them to your doctor immediately. Whenever possible, seek less aggressive alternatives for pain management, such as physical therapies or non-opioid medications recommended by a healthcare professional. In the next chapter, we'll explore an important and lesser-known topic: how certain herbal supplements and alternative medications can pose a significant risk to your kidneys. Although many people consider herbal supplements and alternative medicines to be natural and safe options, this is not always the case. Some products may contain toxic compounds that directly affect kidney health. Prominent examples include comfrey tea and Aristolochia-based products, which are known for their nephrotoxic potential. The problem with these supplements lies in the lack of regulation. Many are not evaluated by health authorities, which means they may contain kidney-damaging ingredients without consumers knowing. In some cases, heavy metals and contaminants have even been identified, which aggravate the risk of toxicity. To protect your kidneys, it is essential to avoid products of dubious origin or those that promise miraculous results. Always check that supplements are approved by reliable regulatory agencies and consult a doctor before taking them, especially if you have a history of kidney disease. Also, pay attention to the ingredients of the supplements you regularly consume. Some combinations can interact with medications you are already taking, increasing the burden on your kidneys. Remember that while natural products have benefits, not all of them are safe for everyone. In the next chapter, we'll delve deeper into how combining medications and self-medication can pose a significant risk to your kidney health. Medication mixing and self-medication are common practices that can put kidney health at risk. Many people, seeking quick relief from their discomfort, combine different medications without considering their possible interactions or cumulative effects. This practice can overload the kidneys, which must filter and process these substances. A typical example is the simultaneous use of painkillers, anti-inflammatory drugs, and over-the-counter cold medicines. Although each may seem harmless individually, together they can increase the risk of kidney damage, especially in people with risk factors such as diabetes, hypertension, or pre-existing kidney failure. Self-medication is another serious problem. Many people are unaware that some common medications, such as those mentioned in this video, can cause kidney damage when used excessively or without medical supervision. What can you do to protect yourself? The first thing is to avoid self-medication and always consult a doctor before combining medications. Tell your doctor about all medications, supplements, or natural products you are using so that he or she can evaluate possible interactions. It is also important to read labels carefully and avoid duplicating active ingredients found in different products. With a little caution, you can significantly reduce the risk of drug-related kidney damage. In the next chapter, you'll learn how to identify the warning signs that could indicate your kidneys aren't working properly. Don't miss it. Recognizing the early signs of kidney damage is essential to avoid serious complications. Although the kidneys have an amazing ability to compensate for problems, by the time visible symptoms appear, the damage may be advanced. One of the most common symptoms is swelling in the feet, ankles, hands, or face. This occurs because the kidneys do not properly remove excess fluid and sodium from the body. Another sign to look out for is constant fatigue, which may be related to toxin buildup or anemia, a condition that often accompanies kidney disease. Also, pay attention to changes in urine. If you notice that your urine is more foamy, this may indicate the presence of abnormal levels of protein. You should also be on the lookout for dark-colored urine, blood in it, or a decrease in the amount you produce. Other less specific symptoms, such as loss of appetite, nausea, or muscle cramps, can also be related to kidney problems. The key is not to ignore these signs, especially if you have risk factors such as high blood pressure, diabetes, or a family history of kidney disease. Perform regular analysis of creatinine and urea A blood test, as well as a urine test, can help you detect problems early. If you recognize any of these symptoms, see a doctor as soon as possible. In the next chapter, we will explore essential habits to protect and maintain the health of your kidneys in the long term. Taking care of your kidney health does not require complicated efforts, but it does require consistency in small daily habits that can make a big difference. Incorporating these practices into your life can help you keep your kidneys in optimal condition and prevent long-term problems. First, make sure stay well hydrated. Drinking enough water is essential for the kidneys to eliminate toxins efficiently. However, avoid excess, as in certain conditions it can overload the body. Consult your doctor about the ideal amount for you. Second, control your consumption of salt. A high-sodium diet forces the kidneys to work harder to remove sodium, which can damage them over time. Opt for natural seasonings and read labels on processed foods to reduce hidden sodium. Third, follow a balanced diet in fruits, vegetables, and healthy proteins. Avoid excessive amounts of ultra-processed foods and limit the consumption of red meat, which can generate waste that is difficult for the kidneys to process. Fourth, avoid the self-medication. Never take medication without medical supervision, and always tell your doctor about any drugs or supplements you are using. Finally, schedule regular checkups with your doctor, especially if you have risk factors such as high blood pressure, diabetes, or a family history of kidney disease. Small daily actions can be the best defense against kidney problems in the future. In conclusion, we will recap the most important points and give you a key message to stay healthy. Throughout this video, we've explored the risks that certain common medications pose to your kidney health. From non-steroidal anti-inflammatory drugs to herbal supplements, we've highlighted how inappropriate or prolonged use can have serious consequences. Now it's time to recap the most important points and leave you with clear tools to protect your kidneys. First, we talk about the NSAIDs such as ibuprofen and naproxen, and how they can reduce blood flow to the kidneys, especially if used in high doses or for prolonged periods. Next, we look at the impact of certain antibiotics, like the aminoglycosides and vancomycin, which can be toxic to the kidneys, especially in vulnerable individuals. We also mention the high blood pressure medications, which, although vital for many people, can increase potassium levels and overload the kidneys. Next, we address the aluminum and magnesium-based antacids, which in excess can cause accumulation of harmful minerals. We talk about metformin, an essential diabetes drug, but one that can cause complications such as lactic acidosis in people with impaired kidney function. We also explore the risks of opioid analgesics, which can cause urinary retention, and, finally, the dangers of herbal supplements and self-medication, which often contain compounds that are harmful to the kidneys. The key to protecting your kidneys is prevention. Maintain healthy habits, such as drinking enough water, controlling your salt intake, and eating a balanced diet. Avoid self-medication and always consult your doctor before starting or combining medications. Remember, small changes in your daily habits can prevent major problems in the future. Regular medical checkups are essential to detect possible complications in time. If you found this video useful, we invite you to subscribe to the channel Health Now and press the bell to receive more essential tips for your well-being. Did you know about the risks of these medications? Tell us in the comments about your experience and if you have ever had problems related to them. Finally, don't forget to share this video with friends and family to help them protect their kidneys and improve their quality of life. Thank you for joining us this far. See you in the next video with more tips to take care of your health and live better.